Welcome, everyone. My name is Caitlin Voidowitz. I serve as the Vice President of Public Affairs at Planned Parenthood Action Fund of New Jersey. As you can hear, I have a very excited dog who is very happy to be a part of this conversation today. We're joined today by Senator Bob Menendez, the senior senator from New Jersey. Thank you so much for being here, Senator, as well as Phoebe Pollinger from National Council of Jewish Women, Essex County section, Alejandra Sorto with the ACLU of New Jersey, and Dr. Tony Otway. Senator, I'll hand it over to you for your opening remarks. Thank you.
Well, thank you, Caitlin, and thank you and your colleagues at Planned Parenthood for inviting me to speak today at this important roundtable. I also want to thank the many partner organizations who have joined us for this forum, including the National Council of Jewish Women, the ACLU of New Jersey, and the Cherry Hill Women's Center, as well as the New Jersey Black Women's Physicians Association and the New Jersey Abortion Access Fund. Before I begin my remarks, I would just like to take a moment to recognize the people of Ukraine. I'm sure, like many of you, I've been watching in horror as Vladimir Putin carries out an illegal, unprovoked attack on a sovereign nation that simply wants to live in peace with the freedom to decide its own future. As we pray for Ukraine in this dark moment of uncertainty, we're resolved to stand with Ukraine as it repels this assault on its democracy, on its freedom, on its territorial integrity, and we're committed to helping it in many different ways. We were all certainly disappointed that despite all of our action, support, and effort, the Women's Health Protection Act did not pass the Senate on Monday. This legislation at its very core places a woman's health and reproductive decisions solely with her and her physician. Codifying the right to abortion care would have ensured that women in America, regardless of the state in which they reside, have equal and unfettered access to reproductive health care. States have passed over 100 bills in the past year alone to restrict abortion and reproductive care access. Frighteningly, the politicalization of reproductive health care has led to laws that will put the health of all pregnant women at risk. We all know how dire a situation this is. The Supreme Court is currently considering Dobbs versus Jackson Women's Health Organization, a decision that could essentially overturn or severely limit the constitutional protections afforded under Roe versus Wade. So as we speak, nearly 24 states with GOP-led legislatures have drafted bills that would immediately restrict abortion rights if the court upholds the Mississippi law. Like the Mississippi law, these bills would ban most abortions after 15 weeks of pregnancy, about 2 months earlier than what the medical community determines is the viability of a fetus. It's hard to fathom that in 2021, there are states across the country like Arizona, Florida, West Virginia, that still consider women's health a political issue instead of a human right. This is unconscionable and incredibly frightening for millions of women and girls. We were all appalled last year by egregious state-level efforts to cut off abortion access, including Texas's heartbeat law that gives anyone the right to sue someone from aiding, having, or performing an abortion after 6 weeks. But we also know we must prepare for even more of these harmful state laws. We cannot stand by idly at the federal level while state legislatures work to turn back the clock half a century and put millions of women's health in jeopardy. Last May, in my role as chairman of the Senate Foreign Relations Committee, I reintroduced my important legislation, the Reproductive Rights Are Human Rights Act. This bicameral legislation, which is supported by leading reproductive health and human rights organizations and activists, directs the State Department to report on the status of reproductive rights in United Nations member states and countries receiving U.S. foreign aid in its annual country reports on human rights practices. With this bicameral bill, we are doing our part to stand in solidarity with women, girls, LGBTQI people the world over whose access to vital sexual and reproductive health care has been severely obstructed or entirely suspended. This legislation makes it abundantly clear: reproductive rights are human rights. And last year, along with Senator Book, I also co-sponsored the Access to Birth Control Act. This legislation would ensure that patients have access to contraception at the pharmacy without delay. It would also address refusals to provide birth control by ensuring that pharmacies do not operate in an environment where patients are intimidated, threatened, or harassed when seeking access to contraception or medication related to contraception. So despite the disappointment we all feel this week with the Women's Health Protection Act failing to advance, we must continue to look forward. I was heartened last week when President Biden announced his nominee to fill the Supreme Court seat that will be vacated by Justice Breyer. Judge Ketanji Brown Jackson is an eminently qualified jurist with impeccable credentials, profound integrity, and sound judgment. Throughout her career, Judge Jackson has excelled as a practitioner, including as a former assistant federal public defender, as a federal district court and federal appellate court judge, writing over 500 legal opinions on a myriad of complex issues ranging from constitutional and administrative cases to matters implicating national security and civil rights. Her nomination marks a historic moment where, for the first time in history, women and girls across America will see themselves more fully reflected in our judicial system. Major reproductive rights groups, including Planned Parenthood and NARAL, have publicly endorsed Judge Jackson's nomination. We all can recognize that Judge Jackson's nomination comes at a pivotal moment in regards to reproductive justice. In the coming months, the Supreme Court is scheduled to issue its ruling in Dobbs versus Jackson Women's Health Organization. And while Judge Jackson will not join the bench until after SCOTUS rules in Dobbs, she will play a critical role in both interpreting and applying that decision and in adjudicating future cases regarding reproductive rights. I'm going to look forward to meeting with Judge Jackson as I fulfill my role of advice and consent in the Senate's timely consideration of her nomination to the Supreme Court. So let me close by saying I want to thank all of you for your tireless efforts and advocacy on what we know is a fundamental human right that affects thousands of people in New Jersey and across the country. And with that, I'll turn it over back to you. Thank you so much.
Thank you so much, Senator, both for your advocacy in the Senate for these important issues and for your vote on Monday, even though the Women's Health Protection Act did not pass. We certainly appreciate all of your support for access to abortion and reproductive health care more broadly.
Thank you.
Dr. Otway. Dr. Otway, we'd like to invite you to give some opening remarks as well.
Hi, thank you for having me on this forum. As an obstetrician, I feel that we're here today because a woman's right to choose what happens to their body has been taken granted for over the past 49 years since Roe v. Wade was enacted. But here we are, we're fighting so many states that are having some of the most restrictive abortion laws. And I feel the only thing Roe versus Wade stands for right now is that an outright ban on abortion before a fetus can survive is unconstitutional. We have some states that are decreasing the time limit, such as Texas, which is 6 weeks. We're having some states that are requiring physicians who perform terminations at clinics to have admitted privileges to local hospitals because of the potential complications that an abortion can have. But abortions are one of the most safest surgical procedures that are out these days. Some states are also requiring that physicians actually show patients and describe a developing fetus on an ultrasound prior to them getting a termination. And some states are actually making patients get counseling one day and returning days later for the actual procedure. So they have slowly and systematically imposed more and more restrictions on the right to a legal abortion over the years. But what exactly does it mean to me and my profession? Basically, it does not allow the providers of abortion clinics to uphold their oath when they graduated from medical school, which was to first do no harm, not just physical harm, but also mental harm. So I'm here today to try and help support the Women's Health Protective Act in the future. Hopefully, we can get it passed on the federal level. Thank you.
Thank you so much for that perspective, Dr. Otway. Phoebe, I'd like to turn it over to you.
Thank you, Caitlin. and Planned Parenthood for convening this very important roundtable today. And very big thanks to Senator Menendez for your steadfast and ongoing support for reproductive rights and abortion justice. It's an honor to be with you and my esteemed colleagues today. The National Council of Jewish Women is a grassroots organization of volunteers and advocates who turn progressive ideals into action. Inspired by Jewish values, NCJW strives for social justice by improving the quality of life for women, children, and families, and by safeguarding individual rights and freedoms. Since 1893, NCJW has fought for abortion access. Many do not know that in the 1920s, NCJW helped found the first 10 birth control clinics in this country. Those clinics later became Planned Parenthood health centers. Yes, there are those who wish to deny reproductive freedom, to deny one's own moral and bodily autonomy, to deny individual liberty guaranteed under the Constitution. Systemic inequality in access to abortion continues to exist across this country. NCJW holds that every individual has the right to bodily autonomy and privacy, free from governmental, political, and religious interference in all healthcare decisions. We are resolved to protect every person's right to reproductive choices, including safe and legal abortion, medically accurate information, access to contraception, and the elimination of obstacles that limit reproductive freedom. NCJW joins you in the continued fight for the passage of the Women's Health Protection Act for our rights, our equity, and our access. Thank you.
Thank you, Phoebe. Alejandra.
Hello, everyone. I'm so honored to be here today in this wonderful panel. And I think first and foremost, we come to this issue from the racial justice. This is a racial and economic justice issue. And as we see these unprecedented attacks on abortion care across the country, front and center of that are the communities most impacted by these barriers that we see, by these bans. And it's the same communities that we see impacted by over-policing, by lack of access to education, to housing, to fair wages. It's the communities impacted by systemic racism. And abortion care and abortion access is part of that intrinsic connection with all the other issues that many of us are working toward to build a more just country and society. So where, as the senator said, and many of you have said, we are seeing ongoing attacks across the country. We have a Supreme Court poised to overturn its decades-long precedent in Roe v. Wade, and at the same time, the long-lasting and devastating effects that we are seeing across the country, particularly on the most vulnerable communities across the low-income communities, the people of color, immigrants, are the most impacted by barriers in any of the forms that they take, whether it be outright bans on abortion or financial barriers to abortion, which is a lot of what we're seeing here in New Jersey. And all of those are deeply connected to systemic racism. And that's what our vision for reproductive freedom is bolder. And we are seeking to not only protect the right, but make sure that every single person who needs it is able to access the care that they need.
Thank you, Alejandra, for bringing that important perspective about New Jersey and what we have been able to do here in terms of protecting the right to abortion access. But we know that, and we've said many times, that rights without access are meaningless. So thank you for highlighting that. My first question is actually for you, Alejandra. What significance did Monday's vote on the Women's Health Protection Act hold, and how would it have improved rights and access for Americans if it had passed?
Sure. The Women's Health Protection Act would have established a statutory right, not only for patients to access abortion, but for healthcare providers to be able to provide it without restrictions or barriers. So this legislation would have allowed that protection to the fundamental right to reproductive autonomy and accessing abortion. And it would have also tackled a lot of the barriers that we're seeing across the country that are targeted towards providers particularly. So this legislation would have advanced access and the ability to provide the care for everyone across, regardless of their zip code or what state they live in, especially in the face of what we're seeing, like hundreds of attacks in state legislatures across the country that are trying to outright ban abortion. And this legislation would have provided federal protections and allowed for states to be able to fight back against these restrictions. So we're deeply disappointed, as Senator Menendez said, that anti-abortion senators blocked the passage of this legislation that would have enshrined this right for so many people. So we're hoping to continue to work together to fight against this, both at the state level and at the federal level, to seek protections, especially as we expect a devastating decision in the summer from the Supreme Court, something that could gut Roe v. Wade, but at the same time, the urgency is in the effects that we're seeing in communities and in states like Texas and Mississippi and Florida, and the many states that are poised to outright ban abortion given the Supreme Court decision. So this legislation would have added a protection, but and we're deeply disappointed to see the vote on Monday. Absolutely.
And Phoebe, you spoke in your opening remarks, which I thought was quite poignant, about how the faith, the Jewish faith, impacts your work on this issue. Can you speak to a little bit more how your faith intersects and brings you to this work?
Sure. Thank you, Caitlin. You know, it's always hard to talk about reproductive rights without thinking of the late, great Justice Ruth Bader Ginsburg, who kept the Hebrew words tzedek, tzedek, terdaf, which means justice, justice shall you pursue, framed on the wall of her office. It's one of Judaism's guiding principles, along with our Torah's instruction, but really it's actually call to action to never forget the stranger, to never forget those whose freedom and opportunity are not guaranteed. We advocate for and fight for reproductive health rights and justice for everyone because of our religion, not in spite of it. You know, there is not just one religious belief when it comes to abortion. Our religious texts tell us that protecting the pregnant person is our priority. The fetus is not considered a person under Jewish law and does not have the same rights as one who is already living and functioning. In fact, various Jewish sources explicitly state that abortion is not only permitted, but required in the event that the pregnancy endangers the life or physical health or psychological health of the pregnant person. Laws and regulations which restrict access to abortion violate our religious liberty by preventing us from following our faith in the provision of reproductive health care and abortion services. As stated in the amicus brief, which NCJW and 50 other faith-based organizations filed against the Mississippi 15-week abortion ban, quote, no government committed to human rights and democracy can privilege one religion over another. Our support, therefore, Caitlin, for abortion access is our pursuit of justice for everyone.
Thank you for that, Phoebe. And yes, today, I think especially we should be remembering the late, great Justice Ruth Bader Ginsburg. So thank you for that. Dr. Otway, I'm curious, as a medical provider, why do you feel access to abortion and the full range of reproductive health care options is so essential to your patients?
As I said before, I think you also, it's not just the physical stress that having to have an abortion has on a patient, it's also the mental the mental harm of both having to make the decision to have an abortion or to carry the pregnancy if they have no choice. The decision to have an abortion is not done in a vacuum. It's not just done by the teenager who forgot to take their birth control. Most of the abortions are actually done by women who have families and feel that another child is just not what they could do at that time. I've had patients who have had to come from religious institutions because they are going through a miscarriage, but because there's still a heartbeat, those institutions have refused to terminate the pregnancy, even though the pregnancy will never go to term and could actually endanger the mother by setting up infections and can actually kill a patient if that termination has not been provided. You've got women who have genetic problems or multiple anomalies that are just not compatible with life. Imagine the stress that a woman has to go through to carry a pregnancy to term, knowing that you're going to leave the hospital without a newborn, and trying to alleviate that suffering, to me, is extremely important. You've got patients who took their birth control on time, who did all the right things, went for their appointments, went for the IUDs, but still there is always a failure rate with birth control. So what option do they have when they've actually made the decision to try and spread out pregnancies or prevent pregnancies? What do those women do? And let's not forget those women that are endangering, their health and their lives by actually carrying a pregnancy to term. It is actually far riskier to carry a pregnancy to term than to have a legal abortion. So for me, it's extremely important, not just physically, but mentally, to be able to offer patients legal, safe abortions. And I believe in this country, it's incumbent on all of us to try not to go backwards. We're supposed to be a civilized country. We're supposed to be a country that is progressive. So why are we going backwards? Desperate women will seek desperate things. And usually those things are usually self-inflicted. So for me, it's extremely important to still continue to offer abortion, legal abortion, to the women of the United States.
Absolutely, Dr. Otway. I think you bring up a very important point, which is that abortion has always been a thing. It's happened before Roe v. Wade. It will happen if Roe does fall in June, when we expect the Supreme Court to render their decision. And it's about either having access to safe and legal abortion or unsafe and illegal abortion. So thank you for that reminder. Which actually leads quite nicely into the next question, which is for anyone who would like to answer. What can we do now to help protect access in a post-Roe world? And Alejandra, maybe you'd like to speak to this since you brought up access earlier.
Sure, I can kick us off and then, of course, welcome the other wonderful panelists. So I think a little bit of background, as many of you know, on January 13th of this year, New Jersey signed into law the Freedom of Reproductive Choice Act. This is a legislation to protect the fundamental right to abortion. While not as robust as the Reproductive Freedom Act, a legislation that many of us staunchly fought for over 2 years, this legislation is an important step, especially in the face of attacks that we're seeing nationwide. So New Jersey has taken a step to protect the fundamental right, and there's more we can do. As we said, the right to abortion without removing the barriers, particularly for the most vulnerable amongst us to access that right, is inaccessible, and that's what's needed. And that's what many of us across states that can make change to make abortion not only protected, but accessible. That's what we should be striving for. And in New Jersey, that looks like removing barriers, financial barriers, particularly to access abortion. We have the fundamental right protected, but so many people, particularly low-income people, immigrant communities in our state, and people of color who are disproportionately impacted by barriers to healthcare. And it's something that we have seen very clearly with COVID, and who is actually impacted the most for when it comes to inequities to healthcare. Those are the same folks that are not being able to access the care that they need in terms of reproductive health care. So in New Jersey, the next steps that we urge our legislature and our lawmakers to take are in ensuring that access is front and center, and that equity is at the forefront, and that as a state we stand firmly, especially as we're seeing attacks nationwide, as a state that we stand firmly for equity and racial justice, and that we remove insurance cost barriers, that we make sure that undocumented communities have access to reproductive health care, including abortion, and making sure that this healthcare reaches everyone who needs it.
I think it's important to point out that it's fundamental to educate so many of our friends, neighbors, family, people in our community who have had the benefit of access to reproductive health care all along. NCJW, because we have operated a Center for Women since 1981, we have seen firsthand the decisions that our clients have to make, whether to pay the rent or to put food on the table. These are critical decisions that people make on a daily basis, and we need to be aware of the communities and the situations which prevent people from getting beyond the barriers to reproductive health care. NCJW has an initiative called 73 Forward, which takes on a lot of these issues in education, in having courageous, what we call courageous conversations. And these are a lot of times focused on intergenerational conversations. For those of us who were around before Roe, before the pill, and what the advent of legal abortion and contraception have done to make a difference in our lives, and how important these rights are for our friends, our family, our children, our nieces, our nephews, whoever needs this help. We educate, we organize at the grassroots to inform. And the more we educate also, we correct the incredibly shameful amount of misinformation and lies and medical inaccuracies that are out there, and inform people to be able to make the truly informed decisions for their lives and their families. So this is a combination of effort, legislation, regulation, administrative work, grassroots organizing, and education for everyone to push forward full access to all reproductive health care, including abortion, for everybody in our state, certainly, and those around the country.
Thank you, Phoebe.
I just wanted to say one thing. I don't want people to think that just because in New Jersey this law was passed, or that, you know, New York or New Jersey, such liberal states, they still have their share of problems. We still have patients who are harassed about going into clinics. We still have hospitals that technically allow abortions to be performed, still have staff that refuse. I personally have had staff refuse to assist me on terminations and to provide care for these patients, staff that are employed by the hospital. And we still have physicians in private practice who are still very cautious when providing abortion care for fear of being harassed. So don't be fooled that just in these liberal states, there's still not issues that need to be overcome, and to protect the women that are seeking this care. Over the years, the need for abortion has been significantly being reduced because of better birth control, better access to birth control. And it increased even more so when the Affordable Care Act came in. When that came in and women were allowed to get better birth control, IUDs, more accessible to the pills, we saw significant reduction in abortion requests. And so for me also, it's not just about providing the abortion care, it's about what do we do to try and educate? Where is the education in the high schools about protecting themselves, about having access, full access? It should be just as easy to get birth control pill as it is to get Viagra. And it just seems to me that the states that are trying to put in the most restrictive laws are those states that fought and still fight in the Affordable Care Act, are still not putting birth control and education front and center before everything else. So that to me is very, very disheartening also.
Thank you, Dr. Otway. And there was a question that did come through. Phoebe and Dr. Otway, I think you both spoke to this about how often abortion is framed as a either religious matter or a political issue, when really it's healthcare. And the question is, how do we change the culture so that we recognize abortion as healthcare? And I think that is part of what we're trying to do today, right? Talk about abortion as a medical procedure, as something that everyone has the right to access. And that is a long, long conversation. I'm sure we could have an entire hour just dedicated to how to change the culture and end abortion stigma. But I want to thank you all for the work that you're doing, even here today, and talking about this issue. So thank you. The next question I have for everyone, and anyone, please feel free to jump in here, is why is abortion access a racial and economic justice issue? And how can we make sure that we're not leaving anyone behind when trying to protect access to abortion care?
Well, it's always been a racial and economic justice issue. Roe did not change that. You just have to look at the Hyde Amendment, which came in virtually the next day, it seems, which targeted low-income people on Medicaid, people on government-funded health care. It even reaches into Peace Corps volunteers, military personnel, pregnant people in prisons who get their support from community health centers, and even survivors of human trafficking, along with the low-income residents of Washington, D.C. These are folks who are not able to have abortion covered. So if you look at the Turnaway study, which looked at people who were denied abortion care over a 10-year period, you will see significantly higher poverty rates, lower credit scores, more bankruptcies, more evictions, a cycle of poverty, an inability to get onto the economic ladder to move up to better support themselves and their families. These are facts. And this is why it is so important that anything that we put forward, legislation, regulations, must be intentionally looking at the impact on all communities so that no community is left out of coverage and access.
I can just add a little bit to that. I think when the question came in about how do we change that, I think another key piece is seeing the direct connections that it has with many of the other issues. I think seeing this as like a silo is also not helpful in understanding how deeply connected it is to immigration, to the criminal legal reform, to housing, to education. All the issues, the common thread that they have is that they impact disproportionately the same communities. And the common thread is white supremacy. The common thread is racism. The common thread is that the system is set up in a way to function exactly how it's functioning, and making sure that the same communities that are impacted continue to be impacted by these systemic and discriminatory practices and policies. And in talking about those connections and talking about how the system is set up in an equal way is, I think, how we also begin to see that and build a broader movement that connects all these issues as well. So when the history of it's not by chance that when COVID came, who was impacted the most? It was the Black and Brown communities. It was the low income communities. Why? Because of the historic underinvestment in healthcare in these communities, right? So an abortion is deeply connected to that, and healthcare as a whole is deeply connected to that. And making those connections with all the other movements is how we begin to see those threads and begin to fight against it and dismantle these systemic barriers that are in place. And making sure that whatever reform we're seeking, whatever legislation we're pushing through, that it is the communities most impacted that will benefit from it. That is it, because when like the most impacted benefit, it benefits everyone else. So thinking of it from the most grassroots level, the most impacted communities, and how this legislation will impact them, and how it will bring access to their fundamental rights and make sure that they're able to exercise these rights.
I think speaking to that question that came in about how can we change the culture, I don't think you can actually change the culture or people's beliefs, but it has to be such that if the law was codified and it was federal, it's the law. There's nothing anybody could do about it. And that's just the way it is. We have the law with seatbelts. Everybody wears their seatbelts. And if you choose not to, then it's your choice. So I don't think you can actually change people's minds. But what you can do is you can put in safeguards that everybody has the right to make their own determination. And to me, I always look at women's rights as a long-term thing. When you have women who are getting pregnant, at times that is not necessarily the best time for them. You're taking them out of the workforce, you're interrupting their education, you're interrupting their contribution to their long-term retirement funds. And when it comes to retirement at the end, now a lot of women are behind the 8 ball because they haven't contributed into the retirement fund. So now you have women who are going into retirement and don't have the support. And so I think it's a whole, it just impacts their life all the way through. So I think it has to be, the law just has to be codified, and just everybody just has to understand that it's an individual right to have an abortion, a legal, safe abortion.
Thank you for that. And I just want to appreciate everyone and your time today and say thank you once again for joining. And I know the senator had to step away. He has a very busy day and a very busy week, but we're so pleased that he was able to join us. Before we wrap up today, I wanted to give each of you a chance to highlight your organization and any ways folks may be able to get involved if they are interested in learning more. Dr. Otway, would you like to go first?
I am actually just helping out a friend who is, she started a group called New Jersey's Black Women's Physicians Association. So I'm just getting more and more involved in that. And I don't have any links right now to say, but we support women's rights, and we have been very instrumental in helping with pushing vaccinations and education throughout the state of New Jersey.
Thank you. Phoebe.
National Council of Jewish Women has a variety of ways that you can take action and become involved. You can go to ncjw.org, our national organization, and sign up for calls to action and look at the advocacy issues that are being covered. And so many of them, as Alejandra pointed out, are the intersectional issues such as voting rights. NCJW Essex County section right here in New Jersey, ncjwessex.org. We have a reproductive rights committee. We have a variety of other advocacy committees. You can go to our website and sign up to participate. We also have the 73forward.org website, which talks about the courageous conversations and additional ways in which you can participate. And if you are clergy, we have Rabbis for Repro. And it's rabbisforrepro.org, where we encourage those in the clergy to educate their congregations about reproductive rights and justice and speak out publicly in support. So there are a number of ways where we'd love to talk to you.
I'm just echoing Phoebe. There are so many issues that folks can get involved in. There's more than enough work. So visit our website. We work on several campaigns. I think a lot of like our main campaigns right now are related to immigration, to police reform, to ensuring that reproductive health care is accessible to all. I know they put our website in the chat, and we welcome you reaching out to us and getting involved in any of the issues that we're working on, and that we like to see it through a racial justice lens and making sure that whatever policies we're fighting for are impacted the most vulnerable communities, and ensuring that New Jersey is a more equitable and just state.
I just have one more thing to say. I think it's just it's incumbent upon all of us to really investigate who we're voting for, because they may not necessarily have our best interests at heart. It's equally important to vote at all levels of government, especially at the local level, which is where it all starts.
Thank you. And if you are interested in getting involved with Planned Parenthood Action Fund of New Jersey, the link is also in the chat for folks, or you can go to ppactionnj.org, follow us on social media for calls to action, and find ways to volunteer on our website. I just want to say thank you all again for joining us this afternoon for this lively and really important conversation. And then again, a huge thank you to Senator Menendez for taking time out of his very busy day to open us up with some remarks and talk about the Women's Health Protection Act. So thank you all. Thank you for joining us, and have a wonderful afternoon.
Thank you.
Thank you.